Let's give a warm welcome to Marianne Faison.
I do want to thank you for inviting me to talk to you today about what some of us say is Obamacare, affordable health care, or in a lot of other names. We've been living with healthcare reform legislation for the past 3 years. And now I think I'm willing to bet that no one in this room has read the over 1,000-page doctrine or legislative doctrine that was passed back in 2010. Unless you're a lawyer, or unless you work for one of the senators or other legislators here, you might have read most of that. I have not read it myself, but so most of us have been reading or understand what we do not understand today based on headlines that we've seen, some commentators in meetings like this, presentations like this, and other ways. But it's very difficult because it's so complicated to put everything together. But no worries, we haven't had to think about it for almost 3 years. But now our backs are against the wall. And starting January 1st of 2014, we are going to be very, very involved in Obamacare. Think about Thelma and Louise. Remember, they were zooming towards the cliff, but they were smiling. Everyone else back there, Tommy Lee Jones is back there worried and concerned. And this is kind of how we're approaching reaching January 1st. We've kind of we know the cliff is there. Thelma and Louise did not. They just were smiling and going over. But we know it's there, and now we got to do something about it. Our backs are against the wall. So let me begin with figuring out how to work this gizmo. There we go. So thank you, Darnell, for doing my introduction here. So I will pass on from the Texas Business Group on Health that you now know about and what we do. And let's launch right into a discussion about the current situation in healthcare. Okay. Went too far. What's keeping you awake at night? I'm assuming you're all employers or employees in some way. You work for companies here today because you're members of the Chamber of Commerce. So we're talking about commerce. It may not be Obamacare per se, but you certainly are worried about the economy. That's a big, big deal, and probably more of a worry of the uncertainty of that than there is of even about the healthcare situation. And certainly you're worried about healthcare reform in many different ways, and you're worried about, maybe even more than healthcare reform, the cost of healthcare and what lies ahead in healthcare. And I assume if you're employers, you're very worried about an unconcerned, unaware, and largely unhealthy employee workforce. That's the reason why everyone is getting into wellness, because we're worried about the loss of productivity and the high cost of healthcare. Why do you even offer health benefits? Well, just kind of going back to the beginning, because it's to attract and retain good talent for your businesses. It takes a long time to train people, and you need them healthy when you've got them and you've invested that much in them. And you want to remain competitive. Most companies want to be very competitive with the others in their own industry, and health benefits is one of the ways. And of course, you want to keep your employees healthy and improve their productivity and have operational excellence and profitability. So just to review a couple of trends here, and this is very brief before we really get into talking about the different ins and outs of healthcare reform. National surveys say that about 61% of employers do offer group health insurance. And I don't know what the numbers are in the Lubbock area. These are mostly large employers that the benefits consultants usually survey. So that's probably representative of large employers. Most of them say that they will continue to play. In fact, the recent survey by the International Foundation for Employee Benefits says that 69% of the large employers, mostly large, will say they're going to continue to stay in the game, continue offering benefits, and about 25%, additional 25% said that they are likely to. The first 69 were certain. And in your survey that First Care did recently, and many of you participated in the survey, it said about 50% of you are thinking that you will continue as before offering your benefits. And the whole reason you're doing so is you want to maintain that employee morale, and you want to reduce the employee turnover, and as I said, keep the talent in-house, and also avoid negative public opinion. And some of the large companies have really been slammed in the news when they were discontinuing benefits or reducing full-time workers to part-time so they wouldn't have to provide benefits. And think about Walmart. They've really faced some large negative opinion. And you also have an incentive, a tax incentive, to continue offering health benefits. So what I did with the rest of the discussion about the healthcare reform is divided up into 4 buckets. The 4 key concerns or critical concerns that employers, whether they're large or small, are facing. And I have them in different sizes because the cost and the communication probably are the biggest concerns. And you'll figure out how to comply and what coverage you need as you go along, I'm sure. So all of these 4 critical concerns are interrelated, are interdependent, but just for organizing your thinking, I've separated them for this. So they really all go together. So let's look at this is a very busy slide, but the key elements of the healthcare reform are what really are going to impact you as businesses. The first one is the individual mandate. Everyone has heard, I'm sure, that's the one page they probably read, or probably the 100 pages they probably read in the legislation, that every U.S. legal resident must have health care coverage, affordable health care coverage, by January 1st, 2014. So that's looming. And then for the employer, but the healthcare reform is built on the employer-sponsored system, and rather than being a single-payer system, it's built on your businesses as being the providers of the health benefits. So for large employers, if you have 50 or more employees, there are 2 ways of looking at the healthcare reform or the impact. For large employers is one category. They must offer affordable coverage to their employees, and by affordable, there's rules around that too. It can't be more than 9.5% of the salary, the employee's salary. So when you're a low-wage company, that can jump way over the 9.5% if you continue as you're doing today. For small employers with less than 50 employees, they are exempt from the penalty. Oh, I didn't say the penalty. If you don't provide health insurance coverage to your employees, you pay $2,000 per employee, full-time employee, as a penalty for not offering health insurance. And then the public exchanges is the third part of this. In small employers, no penalties, as I said. The public exchanges, or now they're calling them public marketplaces, and I'll get to that, the reason why they changed it to marketplace in just a second. You'll see why. Every state in the union must offer public health insurance to individuals and small employers through a public health exchange starting in January. And open enrollment begins October 1st, so our backs really are up against the wall if you're not going to continue with the current coverage that you're offering and send your employees to the public exchange. The state exchanges must be open to large employers by 2017. And I will say that, you probably can't read it, it's at the very bottom. The exchanges for group insurance for small groups was supposed to be open in Texas on January 1st, but it's been postponed to 2015 now. For any state that has a federally run health exchange, it's been postponed. So as small employers in this room, you will not be able to buy your group insurance in the Texas exchange until 2015. And there were a number of reasons why they decided to postpone it, mostly because the federal government isn't quite ready to handle the group insurance policies at this time, because they have to run it in 27 states, including Texas. Okay, let's take a look first at the individual mandate. This is, as I said, effective January 1st, 2014. Every one of us in this room must have some affordable coverage, credible coverage. And or we must pay a penalty. And the penalty is going to be the greater of a fixed amount. And there's a little chart at the bottom that's a little hard to see, but just don't worry about 2015 or 2016, let's talk about 2014. The penalty will be $95, and I'm sure you've heard your employees talk about, oh, it's only going to be $95. Well, no, it's not, because it's the greater of $95 if you're very low wage, or 1% of your family income. So let's take an example. Say, for example, your employees make about $30,000 is a good example of a good salary. Well, that's the difference between the $95 or the penalty for not buying the insurance will be 1% of that $30,000 or $300 a year. So, not too bad, right? Oh, yeah. Pull this up a little bit closer. It's not on very loud, but I'll try. Okay, so that's basically a little chart about you'll pay your tax with your income tax return. The IRS will collect it, and there you'll be. So let's talk about the exchange. So if you decide that you don't, as an employer, you don't want to continue offering insurance to your employees, or maybe you don't do it now, currently, and so your employees will have the opportunity to go to an exchange. Well, a lot of people think, oh, an exchange must be that we go to, like getting our license, we go to the license bureau and stand in a long line, or Social Security office and stand in a long line, and then fill out a bunch of forms and get our insurance. No, that's not what it's like. It's a competitive marketplace. You use exchanges every day. Ordinary people use exchanges every day. If you go on Amazon.com, you use an exchange if you buy something there. If you buy iTunes, you use an exchange. If you use Expedia or Travelocity, you use an exchange for booking your airfare. Or car rentals or whatever it might be. That's an exchange. You don't go to an office to do that. In fact, you can't go to any airline ticketing agency. It used to be all over town, but they aren't anymore. It's all done on the exchange. So it's done online. The exchanges will be an online computer system similar to what you do with Amazon.com or eBay, whatever. And this is just a little rundown on open enrollment starts on October 1st, so there are some things that you have to do by then, and I'll talk about that in just a minute. Every health exchange must be available on October 1st, and for those who seek coverage on the exchange. All the health plans that will be offered on the exchange will be vetted by the Health and Human Services Department. They will only offer qualified plans, which will have to be accredited and qualified by some agencies, and they will be private insurance, Blue Cross Blue Shield, United Healthcare, Cigna, Aetna, and all of the other health plans, health insurers there, will be offering plans on that exchange. And there will be 3 levels on the exchange, three levels of contribution, and the employee or the individual who isn't employed and goes to the exchange will have to figure out, do I want a plan that I pay 40% of the premium, or 30% silver, or 20% of the premium and out-of-pocket costs? And it's very, very challenging. You can imagine how it is for if you buy private insurance just through a regular, like e-health insurance, how hard it is to figure all that out. Well, this is what people who haven't ever had think about their health care before are going to have to think about. Can you imagine how woefully unprepared we all are for something like that? But we'll get into that in the communication bucket. So all plans on the exchanges must offer at least 10 minimum essential benefits. And I have another slide that shows the 10 benefits, and you'll see how complicated this gets. For example, these plans must offer maternity, pediatric, and newborn services. Okay, well, what about a single male who's never getting married, or certainly doesn't plan to for a while, and doesn't need maternity coverage, doesn't need newborn care coverage, and doesn't need pediatric coverage? So that's part of the coverage that single male must purchase if he goes to the exchange. All the information will be standardized and supposedly easy to compare costs and features of the plans. And you should be able to make apples-to-apples comparisons. Well, there's some big decisions ahead. That's the exchanges, the basics of exchanges. But a lot of that flows over into the employer side for employer-sponsored coverage. For large employers, the big decision is, do we play or pay, as they call it. And if the employer decides to play, then they must offer affordable coverage, which has to be less than 9.5% of the salary of the employees, and also dependent coverage. They can charge more for dependents, though. We're just talking about the 9.5 relates only to the employee themselves. If they don't, they have to pay $2,000 penalty for all full-time employees, and those are the employees, and you probably already know this, who work 30 hours or more a week. Well, if you decide to have part-time employees and split up the job into two 15-hour per week part-timers, those equal one full-time, so that counts in as one. So you don't get away with that. But if you decide to have part-time employees that can now work 27 and a half hours a week, which seems to be the level that everyone deems is safe, that would be not considered a full-time employee, so that you wouldn't have to worry about the $2,000 penalty for employees who work less than 30 per week. The other thing is that if you have very rich benefits that you're offering, and some of the smaller companies with high-tech employees to stay very competitive in their industry will offer very rich benefits as a way to attract and retain their talent. And those companies that offer that are going to have to redesign what we call the Cadillac plans, go down to the Volkswagen plans. And they'll have to, they'll lose if they don't reduce the benefits to affordable, then they have to pay a 40% excise tax on the value of the plan, and the threshold for that is $10,200 for a single employee for their value of the benefit, and I think it's $27,500 as the threshold for a family of four. Okay, so that's those who decide to stay in the game. Those who decide to get out of the game and pay the penalty will pay the $2,000 per full-time employee that I just explained. They'll also pay, if any employee goes to the exchange and purchases health care on the exchange and gets a subsidy from the government to offset part of the cost of the premium, then the employer must pay $3,000 penalty for that employee who says, I can't afford what you're offering me, I'm going to opt out and go to the exchange. Now, if you are offering insurance and only one employee decides he can't afford it, you will pay $2,000, not only the $3,000 for that employee, you'll pay $2,000 for all your full-time employees as another penalty. It's a real stinker. So, keep that in mind. There is a cap, and I don't, so if you have 100,000 employees, there is a cap that it'll be the greater or of two amounts, but that's it. Okay, now let's look at the small employer challenges here. There are big decisions for the small employers as well, and not quite as many big decisions as for the large employer, but they're pretty significant. For example, if you're already offering insurance to your employees, and you could decide you're going to continue, and I think, as I said, about half of you said that you'll probably continue, maybe more. Maybe when you get it all figured out, you'll make that decision, but let's say for 2014, you're probably going to. You can purchase a small group plan on for your employers and have no penalty for them. That you can continue to offer the insurance through a regular, who you're already using right now, or buy it on the exchange. But remember, that's postponed until 2015 if you're buying in Texas. And the beauty of this is for small employers, 50 or less employees, full-time employees, there's no penalty. If your employee says, I can't afford it, I'm opting out, I'll go to the exchange, or I'll do something else, or I won't have any insurance. So that's good. There's no penalty for you if they if you offer it and they say no, the employee says no, you're good to go. And you get to keep the tax exemption on your share of the premium, your contribution to the premium. So that's a good thing too. Now, if you decide to drop coverage and send your employees to the public exchange, again, there are no penalties for doing that. But you do lose that tax exemption. If you say, I'm not offering any health insurance to my employees, they can go to the exchange. So, let's talk about the cost. First of all, nobody really knows what the costs are going to be, and we won't know until we're well into 2014. We can only guess, and lots of experts are guessing. They have cost calculators and all these other ways of analyzing how much they think it might cost based on past trends. Well, there are no past trends for this coming year. There's nothing that we really can measure it against other than the knowledge that, and the underwriter's knowledge that, there are going to be a whole lot more people getting health care, and there are going to be a whole lot of them who are not going to be very healthy because they haven't had it before and they've been putting it off until now they get coverage. So you're going to have a lot of sicker people in the healthcare system than we've had before. Now, how do we deal with that? Well, if you're a small employer and you have a young, healthy workforce, high-tech company or whatever your company might be, you invested a lot in their health, and your industry is a low-risk industry. For example, expect to pay more. And then if you have older, unhealthy workers, or you're in a very high risk, like people who, operate big machinery, bulldozers and cranes and what have you, then you'll expect to pay less because there are some rules in the new healthcare law that say you can't discriminate by industry. So the young, healthy, or the high risk or low risk companies will have to spread the cost of care is going to have to be spread for the unhealthy to those who have been paying less because they've been able to. Their experience rated and their experience has been good, so their costs haven't gone up very high. So the estimate is that the young, healthy workforce or low-risk industries will see a 30 to 40% increase in their rates for 2014 compared to what you may have been experiencing, 10, 15, 20%. Those with unhealthy or older workforces, small employers, will end up will have to pay more. And actually, large employers, the same issue. They will end up paying less because they've already been paying more because of their health care costs for their the experience rating. And theirs will go down because the healthy ones are subsidizing the unhealthy ones, or the low-risk industries are subsidizing the high-risk industries. So there's going to be a great leavening of the cost across there, and it's something you're going to have to budget for. So here's another one. This is interesting. We were talking about the costs, and what you're going to see there are some sneak attack costs that nobody has talked about. Every employer, every fully insured and self-insured plan is going to have to pay an annual, we call it the PCORI. It stands for Patient-Centered Outcomes Research fee that is supposed to compensate or pay for comparative effectiveness research that that organization, Patient-Centered Outcomes Research Organization, is doing, and you're going to have to pay it from now. Well, actually, you had to pay it in 2012. You'll have to pay it this year for 2012. Only $1 per plan participant per year. It goes up to $2 for the next 7 years. The second sneak attack fee that nobody talks about is this annual transitional reinsurance program fee, and you'll have to pay that for 3 years. Anyone who offers insurance, whether it's fully insured, which will be paid by the insurer and probably offloaded into your plan rate as the employer, or by the self-insured, which you'll have to add into your premiums as well for your employees. So the transitional reinsurance sneak attack fee, in 2014, this next year, you'll have to pay $63 per plan participant. That's not per employee, per plan participant. Husbands, wives, children, dependents, all those who are in that plan. Like I said, the insurance carriers will pay the fees for you if it's fully insured. The employers who are self-insured will pay the fees themselves, and most likely they'll jump right into your rates. So, those who have low-wage employees are faced with some challenges. They have to buy insurance, no matter what your high wage, low wage, whoever you are, you have to buy insurance. You have to be covered. And in your plan, you shouldn't, the Affordable Care Act, remember, I don't know where they got the affordable from, but anyway, you have to pay up to 9.5% of your salary. Well, what's let's say a lawn service and their employees, legal residents, haven't had insurance at all because they're paid so low, and they just don't buy it. Well, they would rather keep their insurance than go to the exchange and pay whatever the premium is, which is for, let's say, a $9 per hour employee. Point number two, by subsidized, even with the subsidized coverage, they'll still end up paying $70 per month. If you're $9 an hour, as soon as you bump up to over $10 an hour, to about $13, you'll pay double that at $140 a month. Well, a person who's making $9 an hour or less may not want to pay that $70 a month before. So, what's their choice? Go bare and pay the penalty. Well, now this becomes almost a no-brainer decision. I gave you that example before. $30,000 income, you pay 1% of that. Or if you're a very low-wage worker, poverty level, you pay $95. I mean, per year. That's a lot less than paying $70 a month, right? Okay, do the math, not hard. And if the employee is eligible, meaning if they make up to 400% of the poverty level, which the federal poverty level is about $23,000 plus some. So they make about up to $94,000 for a family. Then they're eligible for subsidies, and it's a sliding scale of subsidy depending on what your salary is. And you can go to healthcare.gov to find out what that sliding scale is. It's complicated, but that's basically what it is. Here are some cost options, and this kind of coming down the home stretch here. For larger small employers, particularly small employers, the first one would be, well, for every employer, increase the share of of the cost to your employees for their out-of-pocket, for their premiums or deductibles and copays and so on. But you can only do that up to 40% of the coverage, because you have to, as the employer, have to pay 60% minimum. Here's another option that's an interesting one that might apply to a lot of you here, is renew early. If you renew with your health carrier early, before January 1st, so say sometime in December, then you've bought a year's worth of time, because it doesn't kick in until plans that start on January 1st. So that's kind of like a postponing the inevitable, but gives you time, buys you time. You could join a small employer group, and I believe Lubbock Chamber has a chamber care available here that would spread some of the risks of the costs. You could participate in a private corporate exchange. These are very slow in starting. They are just gaining traction, and most of the benefits consultants are pushing them right now, and only a handful of even large employers are going there. It's the same thing as a public exchange, except it's fully insured and defined contribution, so an employer knows exactly what they're going to pay. They can budget for it more easily, but it's also, as I said, it's new, and I think it'll gain traction in some coming years. And I don't know if there are very many available for small employers, small groups. You could self-insure. Now, this is a new one. There are carriers, the insurance companies are starting to offer, and some of them may offer it in the Lubbock area, for groups that are of 10 or more. So that's for very small employers that you can do a self-insure. It's not good if you've got older, unhealthy workers, though. It's only good if you have a young, relatively young, or very healthy workforce, because with the self-insurance, you can avoid the rich benefits, the minimal essential benefits, and I'll get to that under the coverage. And you can also avoid a lot of the pricing, spreading the risk of the pricing from industry and age-related and other pricing strategies. And the last one is the bare bones policy. If you can see it just above the chairs, if any of you offer mini meds right now, you can no longer offer those in 2014 because mini meds have been popular with like hospitality industry and restaurant industry. The mini meds have an annual cap, on dollar limit cap or a lifetime cap, and that goes away on January 1st. It's one of the rules of the health care reform. So the bare bones is a possibility where you actually are not offering affordable coverage. You're just simply offering a bare bones policy that avoids the mandated essential benefits, avoids the pricing, and it's preventive services only, which you must offer to your employees, because that's one of the primary requirements is to have no-cost preventive services for your employees. So no hospitalization, no surgery, or often no doctor visits even, but it could. So the bare bones or low pay or low benefits plans are there. So check into that if it's something that might interest you. The coverage concerns. This is the second one of the buckets. Already in effect, you probably already know this, you're already dealing with this. Your dependent coverage to age 26, no lifetime or annual dollar caps, as I said, no exclusions for pre-existing conditions, and you have to report the dollar value of your health insurance on W-2 forms for your employees. But new for 2014 is you can't charge your employees for preventive services. There's no gender or industry discrimination. There's some limited age discriminations, but not much. And there is smoker discrimination allowed in the new ones. And what's interesting, just as an aside, there's a big debate going on right now about the e-cigarettes. You probably have heard about that. And the benefits managers are wondering, and everyone's wondering, now are e-cigarettes considered smoking, or are they considered smoking cessation? And that's where the debate goes. I don't think it's been resolved yet. Of course, the e-cigarette makers would want it to be for smoking cessation, but anyway. Here's another coverage concern. I mentioned that there are 10 minimum essential benefits that all fully insured and all exchange plans must offer. And that's where I gave you the example that the single male that is paying for coverage for things that he may not have paid for before, and so in that case the rates will probably go up for someone like that. And as I said, the healthy people will subsidize the unhealthy, who are more likely to need that type of covered services. Now, what this might do is create job lock, or exacerbate the job lock that many employees are in right now, because they want to stay in the plan that they have rather than going out on their own. And paying more, and then it could also boost the entrepreneurs, self-employed entrepreneurs, because now they do have access, will have access to insurance. Compliance concerns, you have to do some things right now, and you have to be ready for this for 2014. So this is your to-do list now. You have to determine the number of full-time employees. Well, first of all, you have to determine you're going to pay or play. Determine the number of full-time employees, and there are some calculations, and you can basically look that up or talk to your broker or benefits consultants about that. You can use look-back periods. You have to determine the affordability. How much is it costing? What is the cost share for your employees? Make sure it's not more than 9.5% of the salary of the lowest income person or salary person on your workforce. Determine whether or not if you're fully insured, whether or not it covers the 10 minimum essential benefits. Report the dollar value on the W-2 forms, and then notify, this is really, really key, notify your employees by October 1st of the availability of the exchanges, the description of their options, bronze, silver, gold, their eligibility for a tax credit if they're low wage, their loss, and that they will lose their tax deduction if they go bare. And then the loss, you of course will lose your employer contribution as well to to their premium. And then there is standardized notification language available at healthcare.gov. There are templates. The DOL is actually, Department of Labor, is putting out the standardized customization language to notify your employer. So there are templates available for that. This comes back to our last point, and that's on communication strategies. No doubt your employees will need lots and lots of help, and these are all the reasons they'll need lots and lots of help. They won't understand. 42% of the population, a recent study showed, is unaware of the Obamacare, of what it means, what its provisions are, and they're totally unaware of these exchanges that are coming up. And they will discover it, though, if they don't have insurance when they pay their taxes this next year, because it'll be deducted on their, taken out of their, or be part of their tax penalty. They won't know how to shop for a health plan on the health exchange if you decide to drop coverage and send them there. Choosing a plan is going to be well nigh impossible, and the government is putting out information to help employees do that, to help the individuals figure that out. But I looked at some of their materials, and I have to say, your health plan has better materials than the government putting out information for the ordinary layperson. There are sources there you can go to. I said www or healthcare.gov. You can also go to the Texas Department of Insurance, tdi.texas.gov, and there's some good information there, and your brokers and your health plans and your neighbor, everybody else. But have a strategy, develop it now, because you can't just move up to October 1st, that's 3 months away, and all of a sudden spring this on your employees. You can't do that. So start an open dialogue, explain the impact, and repeat it, reiterate, tell them why it's important for your company. It's part of the culture of health. Engage your senior management and any other key influencers, but communicate the immediate changes and a timeline, and focus on that communication. It's probably your most critical concern right now. So, Thelma and Louise, are we going over a cliff, or is it just going to be a bumpy road? In my opinion, it's going to be a bumpy road, and I'll tell you why. I don't think we're going over a cliff. We've known about it for 3 years. We know what's looming, and we know some things that we have to do now, and some things, and we know that the costs will be higher. Okay, so be it. We don't know how much higher, but we know it will be. As I said, 42% of the people are unaware of this, but the healthcare system is going to have this massive influx of a lot more people being covered by insurance than ever before. And but they won't be aware of the exchanges, and they won't know what's going on. So the government estimates that only 7 of the 71 million people who will be coming into the system that they anticipate, only about 7 million will join the exchanges in 2014 because they won't know about it. They'll be confused, and because a lot of employers here will say, I'm going to continue as I've been doing and wait and see what I need to do the following year. Let's see what's really going to cost. Then they expect, maybe 13 million in 2015 and 22 million in 2016 and so on until they reach the higher numbers. And by 2017, large employers will be able to be purchasing group insurance on the exchanges, and small employers, of course, in 2015 will be able to do that. And the other reason why it's going to be a bumpy road, not just because of the unawareness or the uncertainty of costs, but because the IRS is going to be managing this. Okay, we're in the middle of a sequester, right? The IRS agents can't even, they're allowed to go like one person to a conference instead of 5 at a time. And they can't have big parties anymore when they go to conferences, right? Anyway, they're woefully understaffed to manage the enormous influx of tax returns that everyone's going to have to figure out and add in the tax penalties, and they're also managing the the subsidies on the exchanges. And if you've ever met an IRS agent, they're smart people, but they're not well trained for this new train coming down the track, and neither are we. So it's going to be a bumpy road for all of us. And do I think that Obamacare is going to go away or be repealed? No, I don't. I think the train is set in motion. I think some little pieces of it might be repealed or changed or tweaked, but it's not going away, and we just have to live with it, and we have to figure out how to deal with it. So it won't be so bad once we get past that bumpy road. So thank you, and I look forward to questions from you and participating in the panel.
I would like to begin introducing the panel, starting with Tim Collins, who's one of our local business owners here. He's the owner of Collins Stone and Tile, and he will give us perspectives from the small business owner. We have Kenan Allen, president of the Davis Allen Agency. He will give us the insurance and product point of view, followed by Brent King from the University Medical Center. He's Vice President of Managed Care Services, talking about community preparedness. And then we have John Grigson, who is the Chief Financial Officer, Covenant Health System, talking about access, impact of services. So let me invite the panel, and this is really going to be very artful how we do this, to take a minute, 2 minutes, and just give you a response or reaction to some of the comments that Ms. Faison has offered us, and then we'll go right into the questions. So let me start on the other end with Mr. Grigson.
Well, as I was listening to that, I was thinking about business owners, which I'm assuming a lot of you here are business owners, and I can only think of one thing worse than being a business owner today with this healthcare reform coming, and that's to be a CFO of a health system. And I know you guys are most interested in the impact this is going to have on you as an employer, but I'm telling you, the impact it's going to have on Covenant Health, and I'm sure on UMC, is almost going to be a cliff for us. Because as you can imagine, how is the government going to pay for all of this? Okay, they've got to give all these subsidies and tax credits and provide everyone with affordable insurance. Well, they're going to pay for it by cutting the reimbursement to hospitals. That's basically how they're going to do it. So they're cutting our reimbursement 0.5% a year, Medicare is, for the next 5 years. It's about $4 million a year they're going to cut our reimbursement. Now the good news was supposed to be, though, we're going to expand Medicaid coverage so that people who don't have coverage now will have coverage and you'll get paid. Because in the past we didn't get paid for people that didn't have coverage. Well, guess what our governor did? He didn't expand Medicaid coverage in the state of Texas. So now the way that we were supposed to get paid as an offset is not going to happen. So we're thinking the annual impact is going to be about $6 million a year to Covenant Health going forward. And I don't want to go too long here, Darnell. And that's just a minor part of it. The bigger piece of this for a provider that we're having to deal with is that half of our business is Medicare. We lose money on that half of our business. And as everyone begins to move to the exchanges, and employers like you may drop your insurance and go to the exchange, we're now going to be paid by the exchange at Medicare rates. So now, half of our business we lose money on, the half we make money on, we're going to now begin to lose money on that half. So for us, as a health system, we're going to have to cut our costs by about 25% over the next few years. For us, $126 million a year. So it is going to have a tremendous impact on the healthcare system. You may think that's good news for you, but you got to remember, Covenant, UMC, we have over 5,500 employees in the community. So the impact to our hospital is going to really impact our community. So I'll stop there, Darnell.
All right, thank you. Go to Brent King.
Well, and I echo everything that John said. We do have some real concerns. You know, I broke out my notes and opportunities and concerns, but Eddie reminded me I only have a few minutes, so I'll just go through some of the opportunities, which are unfortunately small. But with all this was rolled out, some of the information that came out was that hospital systems would need to be able to run on Medicare -10. And you know, we're in a situation of where with accountable care organizations and patient-centered medical homes, which we're both very involved in, we're working to keep the community healthier, to keep people out of the hospital. So that's another level to this, where we're trying to find actionable ways to empower people in the community to manage their chronic conditions, to do things that quite frankly keep them out of the hospital. So that's another layer of the financial hardship for hospital systems, is that the admissions aren't going to be there. I think we both believe that's the right thing to do, to get people to manage their chronic conditions and to work through taking care of their, for instance, diabetes. Our country spends $250 billion a year on diabetics, most of whom don't manage their condition. So that's a low-lying fruit. That's something that community-wide that we can work on with education and some other things that to get those people where they do the right things and don't just come to see us when it's a catastrophic event. Because many of those people are those that are unfunded, that they only come in and they use the emergency room as their PCP, and when they get to us, it's a catastrophic event. It's something large. It's not usually something minor that they're coming in for. So it's getting those people to manage those conditions and to find ways within the community, I think for chronic care management to be a big aspect of this.
Cannon.
Thank you. I think as I listened to the presentation today and I realized how complicated the process is, I start to become concerned about the fact that I only got an insurance because it required the least amount of education that I could take. So obviously, they've changed things for us. But I think what you see up there today, and I know for the last 3 years I've sat through numerous ones of these presentations, I think even if it was the first time you saw it today, your ability to grasp all of it is almost impossible. As an employer, legislatively, they have put you in a position now that you've never been in before. And I think you're probably going to go to or rely predominantly on your agent to give you those answers or help walk you through the process. And what becomes unfortunate about it is it's really a third of it's being an agent, a third of it's being a CPA, and a third of it's being a compliance officer. And the majority of us have tried to become educated over the last 3 or 4 years on how to be able to communicate that to employers. But most of you in this room are business owners or executives within employer groups, but you may have workforces that are less educated or have less access to technology and news and information than the others. So if you can imagine how complicated it is for you to understand, and how we've gone through 3 and 4 years of education to try to communicate that, think of how complicated and intimidating it is to the employee. I know that she talked about some penalties to the employee up here if they didn't choose the plan. I don't really know how we're going to get that information to that employee in a manner in which they can understand it and cover 100% of it. I know we'll get to a majority of it, and I know we'll get better and better at it. In 2014, big learning curve. 2015, we'll get better at it. I know that technology will come along that will help us educate ourselves as business owners, brokers, and help us give information to our employee base. So I know that there'll be developments that come along, but the truth of the matter is it's a very, very complicated, cumbersome, arduous piece of legislation that we're all going to have to grow together to learn how to use.
Thank you, Cannon. Tim?
Thank you. I'd like to first thank the Chamber of Commerce and First Care for partnering together to do this today. What a great opportunity we have to come and learn some things that we probably didn't know, and maybe frankly didn't want to know. But here we are. You know, I'm a small business owner. We started our business in 1984 in my garage. My wife gave me half of the garage, only half, to get started, and I had some student loan money. And we've been very fortunate to have built a business over the years, very blessed to have grown a business over the years, and in a couple more years I'll have those student loans paid off too. And that'll make things a whole lot better for us. But the bulk of our business is business to business. We're not retailers, we're business to business. And so when I look around this room and see some of my customers and see some folks that I hope are my future customers, I wonder how this impacts you. And when it impacts you, how does it impact me? If you don't plan to grow your business and expand, then Mr. Farr here is maybe not going to build an addition to your building. And if I don't get to work for Jimmy, then I don't have work. And so those kinds of things are going to trickle down to all of us. And maybe Mr. Beatonbow doesn't need to build a new home for one of my employees because they don't have an opportunity. So I think we've got huge impacts over the economy. And not to disagree with our speaker, but I think there is a cliff, and I think there's a bumpy road at the bottom of that cliff to go along with it. We are subject to countless regulations today. OSHA, ADA, et cetera, and this one's just one more. We have 16 full-time employees in our operation, and I'm afraid we'll need 20 to get through this, to understand what's going on. Cannon asked earlier how our employees are going to understand how this process works. My fear is it's going to be my responsibility to make sure that they know how that works. And if I don't do it right, then I'm subject to penalty for each and every one of them. And whether I told them correctly, I don't know, but that's going to be a possibility. One of the things that I learned recently was, and again, we have 16 employees, but the way that number is counted to 50 may well be the fact that my parents, in an estate planning event, may be a partner in their business. And so their employees count against me too. And I may have invested in my brother's business to help him get started. His employees count against me too. And so the next thing you know, my 16 count is really a 50 count because my family or my investments brought us to the point of having 50. I read recently, we talked about the state exchanges for a moment, and I read recently that 27 states are going to be looking at the federal exchange. They may not be ready by October 1st. Why? Well, you've got 150 government agencies working on this deal, but more importantly is the fact that private insurance is not very excited about stepping in. And so where does that go? What do we do if the federal government's not ready? And so there are some, I don't guess I've ever been as fearful for small business in this country as I am today. And it just continues to be a reach. It continues to push us to step out to do things that we're not. I'm a tile setter, and I think I'm pretty good at that, but I'm not capable of administrating the kinds of things that small business is being pushed to administer.
Thank you, Tim. I'll just give one analogy with what Tim is just speaking to as a former military man, and for those of you who've served in the military, know that the worst position you could ever be in is walking into a situation where you don't know the enemy you're about to face. And I think that's a good analogy for us because as health plans, as health systems, we really don't know what we're facing, and it's going to be learning as we go. So I think the topics that we're going to discuss today and as we sort of drive forward, it's really going to be reacting to, more than being proactive as much as we can. So I wanted to at least give that thought. I want to go to a provider question because I know both UMC and Covenant are mission-driven organizations, and there's a moral obligation as a provider, if you're practicing medicine, offering care to the community, that really comes to play. And with the mandate, we're bringing more people into the system, and the reality is there's not enough potential capacity. So from a provider perspective, how do you balance or how do you reconcile that moral obligation, meeting mission, and the fact that we're going to have this huge influx of more members or more patients into the overall system? And so maybe, John, you want to take a crack at that?
Darnell, I wish I knew the answer to that question. It is a real dilemma, and one that we are thinking through, actually because we're concerned about being flooded with people who now have insurance for the first time, who've never had a primary care physician. They're going to be looking for a primary care physician. So do we have enough primary care physicians in this community to handle that? And so I'm not sure what UMC is doing, but I know from our standpoint, on our goals for next year is to add 20 primary care physicians to our employed physician group, because it's a part of our mission to see patients when they need help. Now, what you have to understand, though, is every time we bring a physician on board, we lose $100,000 to $200,000 per physician in a 1 to 2 year startup process. You hire a physician, they have to build a practice. The other thing is you got to remember these new members are coming in out of the exchange, and the exchange is paying Medicare rates. And any physician in town will tell you they can't survive on Medicare rates. So it is a real dilemma for us going forward, is how we balance providing access at the same time being able to fund this going forward.
Well, I think it goes back also to what I was saying earlier about getting people treated in the community before they get to the hospital. That's going to be a major aspect of this. Over the last couple of years, we've been working on our patient-centered medical home process, where when people come in, we try to assign them to a primary care relationship. But like John is saying, we're in the process of bringing on new primary care physicians and expanding clinics in order to try to compensate for that. But some of it, I think, is going to be partnering with community agencies, partnering with churches, partnering with other organizations in the community where we get those people treated and identified long before they're going to need hospital care. I'm a hospital guy, and I know I'm kind of preaching against our admissions, but for us and for most hospital systems, and I think Covenant's the same, it's changing from heads in beds over to a community focus on the wellness of the community as a whole, whether that's the folks in Tent City or it's people that are employed with the largest employer in town. It's finding the right care at the right place at the right time for those people, rather than waiting until there's an event and they want to use the emergency room as their primary care physician, like so often happens.
So let's look at it from the small employer's perspective for a second. We realize from the top 5 survey results that most of you in the room at least are saying that you intend to keep coverage. I mean, you feel like you need to provide coverage regardless of what takes place with the exchange, because there's always the fear that these programs will be canceled and then people will be left to deciding on their fate in the exchange. And so I want to ask, starting with you, Cannon, from as much as you can, if I'm a small employer, what are the top 3 to 5 things I need to know as a small business owner beginning January 1? And then I'll ask Tim to sort of give his perspective on that. But I think you were talking about being a counselor, the agent really being at the forefront on the ground. How would you advise on a question like that?
Yeah, and I think we have to split it up into 2 groups, basically 1 to 50 and then above 50, and then someone's going to have to sit down with you and explain your responsibilities as it pertains to your employees. Here is the cost of the insurance, and you can go find that in 3 different ways. Can you find it at a public exchange? Can you find it at a private exchange? Do you not offer coverage and send your employees to the exchange? And if you do, what are the penalties and/or exemptions associated with all 3 decisions? So I think the first thing would be that would come into my mind as both a business owner and a broker is, what do I have to do to be compliant? That's the first thing, because I don't want any penalties if I don't have to. And if I am going to offer coverage, at what level do I offer coverage? And then the next thing would be, who's going to do the math? Who's going to do the calculations for me about the 9.5% and/or whether my plan's qualified or not, whether it meets minimum essential requirements or minimum essential coverages, et cetera. So am I compliant? What are the costs? Where do I purchase this coverage from? And who does the math? And then the last thing that I would that we didn't really talk about significantly today, but there's a reporting piece to this legislation. As an employer now, there's a whole backside of this that you have to do from a reporting perspective that you've never had to do before. So who's going to fill those forms out for me? Where do I get access to the documents that I need to complete to get to? And I think she stated, and I think everybody got a kick out of the fact that the IRS is actually running the program. So that being the case, if you're as scared of them as I am, I want to make sure that I've got all my ducks in a row, all my documents complete, and everything's filed properly. So am I compliant? What's the cost of the coverage? What are the minimums? And then what are the reporting requirements for me on the backside? So I think that would be the way that I would look at it, those 3 or 5 things there.
Okay, and Tim, your perspective, what are you thinking in terms of?
Well, our small business doesn't offer healthcare coverage. And these gray hairs on my chin did not come from old age. They come from worried about making payroll, to keeping my vendors and my workforce lined up and trying to run my business. We are going to have a real issue with understanding what it takes and getting that done. And so, not to necessarily toot the chamber's horn, but this is a great opportunity for you to be involved in an organization whose sole purpose is to help you in your business. And so I would encourage you to look to the chamber, and I'm going to encourage Eddie and Norma and that group to make sure that they're ready to help, because this is what we're going to need as small business people. We run a lean operation, and we don't have the opportunity to add a couple of folks to do compliance, though we might need to. We really can't. And so we're going to need that kind of help from our brokers, from our business organizations, and from folks like that who can help us.
Okay, good. So in the remaining time, I want to shift to affordability. By the way, this is the Affordable Care Act, so we should at least have some mention of affordability. So then I want to look at it from the provider perspective as well as from the insurance and the small employer. How do we, and I'm sure it will take time, how do we get to a place that healthcare cost becomes an affordable event? And so from starting with you, Brent, can you maybe start, and then John maybe jump in? How do we make this affordable?
Thanks for starting with me.
Yeah, me too, thanks.
John was giving me cues to give it to Brent, yeah.
Yeah, I think that's the million-dollar question from an employer standpoint. We're not only just a healthcare system, we're also an employer. We've got about 6,000 folks on our health plan. So it's coming from all angles on this. It is tough. I think it's about trying to keep people out of the hospital. Quite frankly, it's about trying to keep the cost down. I think you've got to look at unit cost. I think you have to look at volume. If there is a way for this to be affordable, I question whether or not there is. Because I think you're getting hit from all aspects. Cannon mentioned this with the reporting requirements. You've got so many different pieces of this, coming from our health plan and our employees that are insured. We have all these same requirements, but if you're a payer, and you know this better than anyone, you've got an aspect of where you're having to reconcile those the premium adjustments and all of the co-insurance adjustments and everything else with the IRS and all these plates spinning at one time. It's tough to find an answer as to what's going to make it affordable. I think you can do process engineering, which is something that I think we're both heavily involved in, where you're trying to take out the waste in the system. Standardization, that's a big thing from a healthcare standpoint. You want to make sure that you have standardized processes with treatment. Those are probably the two big things, without going straight to cost cutting, just right off the top, just making things more efficient.
I guess I would add to that, from Covenant Health's perspective, we will spend $46 million providing health to our own employees next year. So it's expensive to us too. And so we're looking for ways to take that cost down. So I guess going forward, what I think and what our health system, I'm sure UMC is starting to do, is that part of the problem on the provider side is we, the medical centers, we, the physicians, we're all paid for volume. The more we see you, the more we get paid. The more sick you get, the more we get paid. So we're going through this transformation from what we call volume to value. That we're going to have to produce value, not volume. And that's the way this system, we're going to drive the cost down. Now, whose responsibility is that? It's going to take everybody in the community. It's not just hospitals' responsibility, not just doctors. It's our responsibility to manage our own health. So going forward, part of the good part of this legislation is it's beginning this process of making us all accountable for our own health. If you're going to live an unhealthy life, you're going to pay for it. If you live a healthy life, then you're going to benefit from that. If your employees live a healthier life, you're going to benefit as an employer. And so from a population health management standpoint, that's what all the medical centers, health systems around the country are starting to focus on, is how do we begin to get ourselves involved in managing the health of the community, not managing the sickness of the community. We're always going to be there when you get sick or get injured, but we're going to start to play a larger role with you in how do we keep your employees healthy. In the future, if we don't keep you healthy, then we're not going to survive. So that's the big push going forward.
And Cannon, on the premium side, you're an employer, it's not affordable. What type of options are available to an employer with, feeling especially that they have the obligation to at least provide some level of coverage for their employees?
Yeah, I think there's two questions there. The first one is, if you do want to and continue to provide coverage for your employees, what's going to happen to the cost based on legislation? I think there was a portion of the slideshow today that showed that they thought perhaps that would go up as much as 40%. Bottom line is, when you take underwriting away from an insurance company and their ability to evaluate risk based on medical evidence, that they get conservative and the price goes up. They're there to make a profit. So with that price going up, what do? Well, we start to get very creative in terms of what plans designs are and how we treat certain things. I think one of the big keys is what John just said. We got to get a healthier public. And then we've got to start working on our efficiencies and things like that. But the bottom line is, you're going to have to get very creative from a coverage standpoint. And then as an employer, we're going to have to eventually get to the point to where we can reward the individuals that take care of themselves and penalize those that don't, because that's what's literally dragging the system down. If we do get an influx of 50 million people into the system over a 5-year period of time, we all know from an industry perspective that we have a lot of young people, what we call flat bellies out there, that are not insured. And if we can get them in the system, that will help us offset some of the risk from some of us that are no longer the flat bellies. But yeah, I just pointed at me. I was looking at you, but I just pointed at me. Anyway, so I think what we've got to do is we've got to get all phases working together as far as that's concerned, or we're going to continue to see an increase in healthcare that exceeds any inflationary or economic growth figure that we have.
I just tightened my top button after that comment. Tim, I'm going to put you on the spot here. I mean, you've been a very active member in the chamber. What do you see as a major role of the chamber in helping navigate these employer issues? I mean, this is a heavy lift, and there's a lot that has to take place, and with all the obligations, how do you see that from where you sit?
Well, I think this helps to answer one of the problems that I pointed out earlier, and that's our own manpower issues. The Chamber of Commerce is a collective. They have the opportunity to disseminate this information, to gather it up, and to help present it to its membership in such a way that we can understand it, to give us opportunities just like today to come out and hear about things. And it's not about being scared, and not necessarily about learning all the bad things that are going to happen. It's going to be about learning how we navigate the waters as we go forward. Again, we will, in fact, have to go forward. It's my intention to be in business next year, and my bank agrees that that's going to be necessary. And so, as we go forward, we're going to have those help with that. And I think the Chamber of Commerce is absolutely one of the best resources that we can have in our community to get us there. Healthcare is a noble cause. This is important to our country, and so. But what I struggle to understand. We have a lot of different mechanisms that provide coverage and care. Why is this not a zero-sum game for us? I know that you guys provide care to those who can't pay. I know that there could be an improvement in the care provided to some of those who don't have coverage. But why is this such a dramatic jump in costs so suddenly when that care is already there? And I don't know the answer. I wish I did, but nonetheless, Chamber of Commerce is going to be a great opportunity. There are going to be other organizations that are going to need to step forward. I think the government is busy making rules. If they could get through making rules and start telling us about them, I think they have an obligation to us. And I'll get on my soapbox, or get off my soapbox in a minute, but I'm going to get on one right now, and that is the poll. We have the voice to make this thing go away or stay, to make it right, but you've got to do it at the polls. And I think when we look at a presidential election with 20% turnout or less, that's telling us where the answer lies. Okay, I stepped down now.
All right, thank you. So we're nearing our time, so please join me in thanking the panelists. Folks, this is just the beginning, and I agree with our panelists, the notion that it's going to take everybody in our community to navigate over the next several months. It's going to take a whole different approach. It's going to take a collective set of us working together so that we can make this process as smooth as we can, even though we do expect major bumps along the way. And just if you just bear with me for 1 minute, and I'll turn the podium back over to Carlos. I want to talk just a minute about First Care's effort and what we're looking to do to enable the chamber to reach you and to help you navigate this process. I'm happy to announce that the chamber and First Care have reached an agreement to deepen and extend our current relationship. We will be working together to improve our current benefit plan and program and to extend its value to the community. We have also agreed to work diligently to help Lubbock as a community improve health care for all members and the broader community. So over the next several weeks, you will be hearing more about this relationship in the coming months. Lubbock and the Chamber will be seeing the benefits of our expanded partnership. It does take a community, and it will take all of our collective efforts for everyone in this room. And we're excited as a company to embrace and to join with the Chamber in making this possible. So I wanted to at least make that announcement, and I want to thank you personally for this great attendance. I mean, this is big. I mean, you guys have stepped up and you said this is very important. And so we know that in Lubbock we have a very engaged community. And so with that, I want to turn the podium back over to Carlos.
Darnell, thank you very much. We also highly cherish your not only your partnership but your friendship as well. To the Chamber and to all of our members, I definitely think this partnership is going to be extremely beneficial to all of our members. So again, thank you. Guys, thank you on the panel. Thank you all very much. Marianne, thank you for your presentation. But again, thank you all for coming. Appreciate it. Again, look for this presentation online in your email. Thank you.